Congressman Peter DeFazio, one of my favorite members of the House of Representatives, a great progressive, very thoughtful, very insightful guy. One of the few people whose opinions I always trust is on the line with us. One of the few politicians in D.C. Say what, Congressman?
Hello, I just thought I got lost in the ether there.
Oh, okay. No, you're here, and you're on. And I wanted to talk with you about a number of things. First of all, just very quickly, you are knee-deep in antitrust legislation, and we were talking on the phone before we went on the air, and you said that you think that the antitrust legislation coming out of the Senate is a little light?
It's very, very narrowly based, and we already have a couple of big cases where the insurance industry, given those restrictions, has still been able to collude. We just need to take away the antitrust exemption from the insurance industry, make them compete under the same rules as every other industry in America except professional sports. And Consumers Union argues, their analysis is we would save, if we did it for all insurance, $40 billion a year.
Wow.
If we do it in health insurance, we could save between 10 and 20% of our premiums.
Is the Senate like trying to do some kind of halfway measure on this?
Yeah, it's very, very narrow. They just choose three categories that are most obvious: price fixing and a couple other categories.
Yeah.
But
blow the whole thing out. Just blow it all.
Yeah,
out.
They don't need an antitrust.
All right. So the reason I wanted to get you on, Congressman DeFazio, is you and I have talked on the air before about Social Security and how the reimbursement rates are different in different areas. Why it is that a doc taking Social Security in Miami, Florida, can make a pile of money compared to a doc taking Social Security in rural Oregon, which is the district that you represent in large part. And there was a bill before the Senate yesterday. The AMA put $2 million into lobbying for this thing. Harry Reid brought it to a vote, which means he apparently thought he was going to have 60 votes to push through a filibuster. It went down in flames. Reid is bitterly talking about how he was stabbed in the back by some of the Republicans. Apparently they lied to him. Surprise, surprise. I read the New York Times article, I read the Washington Post article, I read 3 or 4 online articles. I couldn't figure out what this bill was actually trying to do.
Okay. You got to divide the issues between reforming Medicare for the future, which is a key part of adopting this health care bill, and making it work better, making it affordable, and bringing down costs in the system, and this temporary Band-Aid or fix to physicians' reimbursements.
And that was yesterday's legislation.
That was yesterday, and this has been done year by year since 1997. Because there's this awkward formula that links physicians' reimbursement to overall economic performance in ways that would actually reduce reimbursements. Now,
you mean the amount of money that a doc is paid is based on a formula based on the economic activity of the community in which they live?
That is what this 1997 law established for Medicare reimbursement.
So a doc working in a poor area gets less money than a doc working in a wealthy area?
No, we're conflating back to the original issue, which is the disparity in reimbursements. No, this is overall Medicare reimbursement for doctors across the country, and it would be at a very high rate in Miami and a very low rate in Oregon, but they use a national criteria. If every physician in America would get 21% less to see Medicare patients next year, which in my state, where you can barely find a doctor who will accept Medicare because of the low rate, they lose money on every patient, that would be a death knell for seniors accessing doctors. Right. In Miami, it wouldn't matter. I mean, it would mean the profit margin drops a little bit, but, they'll still be getting huge reimbursements, 2-3 times what docs get in Oregon.
So this is the problem that needs to be fixed.
It needs to be fixed temporarily until we reform the system. I mean, we can't tolerate the 21% across the board cut. But what they were doing yesterday was aiming a missile at the heart of health care reform, because Obama has said it can't cost more than $900 billion. To fix this doctor reimbursement permanently is scored around $300 billion. So suddenly the Senate version of the bill, whatever it is now over $1 trillion.
Right. So what Harry Reid was trying to do was fix the doctor thing in a separate piece of legislation so that the overall health care bill wouldn't end up coming in over $800 billion. And if he could have done that, then he could have had his $800 billion option program. But now he's going to have to build the let's pay the docs for Medicare more, particularly in rural areas like Oregon, the fix, as you say, the systemic fix. Now he's going to have to build that into the big health care bill, which is going to make it more expensive, and that's why everybody's so freaked out about this.
Right, and what it would probably mean is a massive reduction in subsidies to people. And in the House, we go up to 400% of poverty level to help subsidize insurance out, that people have to acquire, the big mandate. So it's a real attack, and that's why the Republicans flipped. The Republicans have always voted for a one-year fix, and that during their reign they would only support a one-year fix to the doctors' reimbursement, because every year they would then go to the docs and say, "Hey, we got you over the barrel. Support us.
Give us,
exactly. You got it. You got it."
So the Republicans have been scamming the doctors and playing the system, but now they saw this as an opportunity to blow up the entire health care reform thing that President Obama is trying to do.
Yep.
What probability would you assign at their being successful in doing that as a result of this vote yesterday?
Well, that would mean we'd have to go back to probably a one-year fix or a temporary fix on physicians' reimbursement, which is much less expensive. It would still hurt the bill, but if it had to be in the bill, but it wouldn't be as much of a problem. Or it could be fixed in any omnibus or continuing resolutions elsewhere outside of where they can play mischief. But the key thing is, this is temporary. This is just to tide us over with a system that's broken while we move toward reevaluating Medicare reimbursement nationwide, which we just got an agreement in black and white in the House bill for. We're finally going to deal with the issue of geographic disparity, where you see reimbursement for a senior in Miami is about $16,000 to $17,000 a year, and in Hawaii it's $5,000. And I would argue that Miami, Hawaii, similar climates, retirees. I mean, what's the disparity except that it's an accident of history? These rates were set 40 years ago. They've been adjusted using an inflationary factor. We've never revisited how they were established, what the real cost of medical care in those areas is. So we have an agreement in the House bill. That'll be done before the public plan option goes into place, which is critical, because if we got a public plan option, there's 17 states where you wouldn't be able to get a single doc to take a Medicare-based reimbursement for the public plan option right today.
Because it's broken right now.
Right. And in Miami, you'd be able to go to the best clinic in town with a public plan option because they would be getting a phenomenal over-reimbursement for you. Right. So we need to fix that, bring down the states that are over-reimbursed, bring up the states that are under-reimbursed. That's an interim fix. Then we put in place a public plan option. Then stage two is we revise the formulas yet again to move towards something that's based in best practices and outcomes. This is going after the issue that was raised in that great New Yorker article about McAllen, Texas, where we have a volume-based system, not an outcome-based system. Right. We need to convert to an outcome, best practices-based system, save a pile of money, make people healthier, and that's stage two of what we've negotiated in the House bill.
Now, in part of my rant that opened this hour, I was the Physicians for a National Health Program, which is a great organization, and they've been for years advocating for single-payer health care in the United States, among other health reforms. They're suggesting, or at least one of their members in a blog today, is the public option is a bait and switch campaign, and it's fooling pollsters. Because most people, when they're asked, would you like there to be a public option, are not being informed that, at least in the Senate bill, that public option would only be available to a very small slice, maybe as small as 5% of the American public. You and I were talking a minute ago, and you said in the House bill, we're going to try and make that much more broad. Tell me about that.
House bill public option would first apply to people who don't get insurance through their employer and to truly small businesses. The next year,
which is what the Senate bill does as well.
Right. The next year, the number in the business would get a little larger, and in the third year of the House bill, it would be up to the commission we create to determine whether or not to open up that program to everybody, which would mean you wouldn't have job lock anymore if we could get there, which is similar to what Senator Wyden was proposing on the Senate side, but got shot down. So I hope we can hold that language in the House bill to give us an opportunity to move that way.
We have just a half a minute left.
Sure.
What do you want your constituents, what should people listening to this program be saying to their elected representatives when they call today to say, hey, here's what I want?
You want a very robust public plan option, and you can just be generic about Medicare and say we want the reimbursements for Medicare fixed, which covers both the short-term and the long-term problems.
Right. So fix Medicare, and this again,
fix Medicare reimbursement.
Right. What the Republicans blew up yesterday in an attempt to as you said, send a missile into the heart of the whole health care reform. And let's have a truly robust public option, not some weak little wishy-washy, just a few people. Congressman Peter DeFazio, his website, DeFazio, DeFazio.house.gov. And Congressman, thanks so much for being with us.
Thank you, Tom. Keep up the great work.
You too. You're a great representative and a great source of information to us. Thank you.